A warm welcome to our flagship Knowing Your Sleep Health Inside Out Public Sleep webinar. I am Eric Lim, co-founder of Somnus Sleep Wellness and certified mindfulness-based stress reduction teacher. Thank you for investing your time with us this afternoon to learn more about how you can enhance your sleep health and make it a priority this year. So we have lined up a very impressive panel of speakers who will be sharing with you their valuable insights for you to get a restful night of sleep. And before we dive in, let's begin by taking a moment for all of us to arrive. So I'll be leading all of us in a short mindfulness practice. So allowing yourself to sit comfortably, you can have both your feet to be flat on the ground. Allowing your eyes to gently close. And let's just begin by taking in these 3 beautiful deep breaths. And perhaps at the end of the third breath, just bring this awareness into the space around you. So noticing the sensations in your body right now as you arrive here. Very briefly, just noticing how does it feel like in your toes, in the soles of both your feet, even in your ankles. Just feeling to this point of contact. Very gradually as you exhale, just shifting the focus up into your calves, feeling to your shin, as well as your kneecaps. And very gently as you exhale, shifting the focus now into your thighs and your sit bones. Just observing what's already here for you. And very gently, as you breathe out, shifting the focus now into your lower back. So you're scanning all the way up from the base of the spine towards the middle back, as well as our shoulders. Just taking a moment, observing whether your shoulders tense or is it relaxed. And gradually, as you breathe out, just letting go of the focus at the shoulders, bring the focus of your awareness into your arms, elbows, and right into both your hands and fingers. Observing whether your fingers clench or is it at ease. And very gently, as you breathe out, shifting the focus away from your hands, coming to your belly. As you breathe in, just observing that rise of the diaphragm. And just exploring the sensations right here in the abdominal region, as well as in our chest. Simply allowing yourself to be present for whatever sensations that's right here for you. Just choosing to be with it. And as you exhale, coming into your neck and your face, observing your facial expression, including just the sensations at your nose, your ears, and even at the top of your head. And so in this way, giving yourself this permission to just rest in this present moment awareness of yourself. And as we come to the end of this short opening practice, once again checking in, how do you feel right now as you arrive here? Taking these expanded moments of awareness to ushering the next few moments of learning about your sleep health. So as you close off, inviting you, just observing 3 more nice, beautiful deep breaths. Beautiful. Great. So with that, can very gently invite your eyes to open if that's closed for you earlier. Bring a nice warm smile onto your face and let's dive into today's webinar where we'll be sharing with you many different interesting topics. And before we move into that, I'd like you to just scan the QR code that you see on your screen right now, so you can input your questions that you have for the speakers, right? Or you can also join at menti.com inputting this code 181606061. All right, so later there will be a slide where you can scan the QR code once again. All right. I'm very excited to introduce our first speaker for this afternoon, and that's no other than Dr. Julian Lim. So she is an assistant professor at the Department of Medicine, Yong Lulin School of Medicine. She's also the principal investigator of the Sleep and Health Laboratory. After obtaining her PhD degree in psychology from the University of Surrey, she received her postdoctoral training at the Surrey Sleep Research Centre in the UK and the Cognitive Neuroscience Lab in Singapore. Her research focuses on the factors and health consequences associated with sleep deprivation in children, adolescents, young adults, and older adults. So I'm really excited to pass the time over to Dr. Jun to share with us, how can we start to care for our adolescent sleep health and what can parents and educators do to support them? So over to you, Dr. Jun.
Thank you, Eric, for your kind introduction, and thank you all for joining me this afternoon for this talk about adolescent sleep health. So in this talk, I'm going to be talking about causes and consequences of insufficient sleep in adolescents. And at the end of my talk, I'll share with you some tips that may help your adolescent children or adolescent students to get more and better sleep. Now, before we dig deeper into this topic, perhaps it will be wise for all of us to first try to understand how much sleep we actually need. Now, these are the sleep duration recommendations by the National Sleep Foundation in the US, and the dark blue areas highlight to us the range of sleep duration recommended for each of the age groups listed here, from newborn all the way to older adults. So as you can see, as we grow older, we are recommended to need less sleep. Newborns are recommended to sleep between 14 and 17 hours each day. And then us adults, we still need at least 7 hours of sleep every day. Now, for each age group, sleeping a little bit less or a little bit more, as highlighted by the turquoise color areas, is still considered what may be appropriate by the National Sleep Foundation. But these orange areas highlight to us that sleeping too little or too much is definitely not recommended. And in terms of the age group we are talking about today, teenagers, they need 8 to 10 hours of sleep every day. So remember, they need at least 8 hours of sleep every day. Okay, it's important to remember this number because actually a lot of teenagers these days do not get 8 hours of sleep. I'll be talking about that in just a short while. Okay, actually, as I mentioned, a lot of teenagers do not get sufficient sleep. And this is obviously a very important problem in Singapore. Actually, this very famous adolescent sleep researcher, Mary Cascadon, many years ago, already called sleep in adolescence the perfect storm. And there is a reason, well, several reasons behind this, both biological reasons and psychosocial reasons. So biologically, actually, during adolescence, there is a maturational delay in circadian rhythm, meaning that during adolescence and also young adulthood, okay, early adulthood, our biological clock is the latest. So biologically, we are programmed to prefer to go to bed later, probably the latest, and wake up the latest during adolescence, okay, as compared to when we were younger or when we become older, okay? And also, as we stay awake for longer and longer, okay, we become sleepier and sleepier. This is true also for adolescents. The pressure for them to fall asleep becomes higher and higher as they stay awake for longer and longer. But this increase in sleep pressure as a result of increase in wakefulness duration actually slows down during adolescence. And all these biological changes actually mean that even late at night, teenagers may not feel sleepy. And when they do not feel sleepy, they will just opt to go to bed later. Okay? And from a psychosocial perspective, we know that teenagers actually try to get more and more autonomy. And as parents of teenage children, probably you are more willing to give them autonomy because they are on the way to becoming an adult. You cannot keep controlling them. Okay. And typically part of the process involves giving them the freedom to choose their own bedtime. And as I mentioned just now, teenagers do not feel sleepy at night. If they are given the freedom to choose their bedtime, most likely they will choose a late bedtime. And these days, pretty much all the adolescents have a phone, a mobile phone, or at least they have a laptop. Okay. A lot of the times during the pre-sleep period, they use their gadgets, okay, for studying, for entertaining themselves after a long day of study. Okay. And a lot of the times they use the devices during the pre-bedtime period for something fun. And when you're engaging in something fun, you forget about time. It's time to go to bed. So as a result, your bedtime is later. Okay. And some teenagers, they are very hardworking. They keep studying until late at night. And the high academic demands in Singapore also may play a role in shifting or postponing bedtime in teenage students here. There is no issue. There's not going to be any issue with short sleep in teenagers if teenage students can sleep in. But we know that in Singapore, actually, secondary schools typically start at 7:30. So if you factor in the time the teenage students need to travel to school, groom themselves, have breakfast, hopefully there's still time for breakfast before going to school, they really need to get up very early in order to arrive at school on time. A lot of them actually get up before 6 in the morning. It's like getting ourselves adults to get up at 4 in the morning to get to work. I hope that you do not need to do that very frequently and try to recall what happened last time when you had to get up so early in order to go to work. You probably were very sleepy during the daytime. Unfortunately, well, I hope that that's just a one-off issue for you, but unfortunately for teenage students, obviously they need to go to school pretty much every single day during the term time. So this is definitely a recurrent issue for teenage students in Singapore. And because of all these biological and psychosocial factors, perhaps it's not surprising to know that in Singapore, actually, as indicated by these black bars here, the distribution of school day sleep duration in Singapore, actually 85% of the teenage students here sleep less than the minimum recommended sleep duration of 8 hours, particularly on school days. Now you can see a clear rightward shift in this sleep duration distribution from school days to weekends as indicated by the black bars here. This means that a lot of them try to catch up with their sleep over the weekends because, over the weekends, there's no school, there's no need to get up so early, so they can finally sleep in and try to sleep more, okay? But still over the weekends, about 1 in 5 of them still do not get 8 hours of sleep. And all of us know that, during a school time, well, now we are having a school holiday for 1 week, so our kids can actually sleep in for once, okay? But actually during a school term, which lasts for multiple weeks, a lot of these teenagers are exposing themselves to multiple weeks of short sleep on school nights, and then sleep extension over the weekend as recovery, okay? We were particularly interested in learning more about the impact of this kind of sleep schedule on the cognitive functioning of adolescents because every day they need to learn, okay? There's a lot of cognitive demand placed on these adolescents. Now, that's why we conducted a series of studies, and in these studies, we gave different groups of adolescents different sleep schedules. And then we measure many different cognitive functions in these adolescents. Okay, today I'm going to be focusing on a cognitive function called vigilance, which some people call sustained attention. That's the kind of attention you need in order to stay focused for a long period of time. I picked this cognitive function to highlight today because obviously teenage students need to stay focused in class, and class typically lasts for more than half an hour, okay? They need to stay focused in order to be able to learn effectively. And also this is the cognitive domain that's most sensitive to sleep loss. When you do not have sufficient sleep, most likely vigilance will be affected, okay? So over here at the bottom, I'm showing you this very flat black line, which shows that for this group of adolescents that were given 9 hours to sleep every single night from the beginning, you can see my cursor, from the beginning to the end of the study, they show about 2 to 3 lapses in attention in this 10-minute, very, 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 very boring attention task called the psychomotor vigilance task, or in short, PVT. Okay, so they show about 2 to 3 lapses in attention, or 2 to 3 slow responses within this 10-minute boring task, okay, which is very good performance. Now, in another group of adolescents, we actually gave them 8 hours to sleep each school night. So from Sunday to Thursday, they slept for 8 hours. They stay in bed for 8 hours. And this is what we see in terms of their performance in this boring task from Monday to Friday. Okay, you can see that reducing the school night sleep duration by 1 hour actually did not really lead to any impairment in their vigilance performance. And over the weekend, we gave them 9 hours to sleep per night. Okay, they were still pretty well in terms of their vigilance performance. And then the following week, we gave them another 3 nights of 8 hours time in bed. And still, they were pretty good in terms of vigilance performance. Over here, I'm showing you what happened to this group of adolescents that were given 6.5 hours to sleep each school night. Okay, we picked 6.5 hours because this is the average sleep duration on school nights among Singaporean teenage students. So over here, you can see that if Sunday to Thursdays, these teenage students only got 6.5 hours to be spent in bed for sleeping. Monday to Friday, they show this pretty much continuous increase in the number of lapses in attention, indicating cumulative impairment in their vigilance performance as they curtail their sleep for more and more nights. Now, over the weekend, we gave them 9 hours to sleep per night. This did bring down the number of lapses in attention, but it never returned to the baseline well-rested level, meaning that even catch-up sleep, extending sleep over the weekend to 9 hours per night, might not help with full recovery for adolescents' vigilance performance. Now, obviously, as I mentioned, school term lasts for multiple weeks. So if in the following week, they expose themselves to another 3 nights of short sleep because they had to, get up early. Again, they slept short again. You can see that this actually resulted in further deterioration in their vigilance performance. It's more prominent than what happened in the first 3 school days in the previous week. Okay. And we had another group that only had 5 hours to spend in bed on each school night. You can see that this resulted in even more prominent deterioration in the vigilance performance in the second week, okay? Meaning that when sleep restriction became a recurrent issue, this did result in even greater impairment in the vigilance performance. Okay, so now, as I mentioned earlier, we actually study many different cognitive functions in these adolescents as we expose them to all these different sleep schedules. Actually, in addition to vigilance impairment, we also found deficits in their working memory and executive functions as they curtail their sleep for more and more nights. Okay? These sleep-restricted adolescents also were slower in processing cognitive information, so they could not handle information as fast as they would like or when they were in a well-rested state. They reported being sleepier. They also reported less positive mood. So recurrent short sleep may also lead to probably mood issues in teenagers. Okay, so how can we attenuate these deficits induced by recurrent sleep restriction in teenagers? Today, I'm going to propose 2 solutions. The first one is delaying school start time. Okay, so a few years ago, we actually partnered with one of the high schools here in Singapore, which agreed to delay its start time by 45 minutes. So the school delayed start time from 7:30 to 8:15. I have this asterisk here to highlight to you, yes, 8:15 is considered a late school start time here in Singapore, but actually it's still 15 minutes earlier than the earlier start time recommended by a few professional bodies in the States, including the American Academy of Pediatrics, for example. Okay, so we collected some sleep and well-being data from these teenagers both before the school delayed its start time at baseline and also 1 and 9 months after the later school start time had kicked in. So what you can see in this figure over here is that on weekdays, after the school had delayed its start time, these teenagers did report a 23 to 22-minute increase in time in bed. Okay. Over the weekends, there was some sign that these teenage students were getting less sleep, but it's actually a good sign because this means that on weekdays, they were sleeping more, they were accumulating a smaller sleep debt. So over the weekend, they did not need to extend the sleep as much now after the school delay is school start time. Okay. And we also measured the sleep objectively with a watch light device. And we did see a roughly 10-minute increase in these teenage students' actual amount of sleep on weekdays after the school delay in start time. Okay. In addition to these positive changes, these increases in sleep duration we observed in these teenage students, these students also reported lower sleepiness rating, fewer problems staying awake, feeling more refreshed, less negative mood, and lower depression score, both at the 1 month and the 9-month points. Okay? So these benefits were sustained even when we collected data at 9 months after the school delay in start time. So these were sustained benefits. Now, a lot of you may be saying, okay, June, there is nothing we can do about school start time. What can we do at a personal level to help teenagers to combat all these negative impacts on their cognitive functions when they sleep so little at night? So this is what you may try, okay, napping, taking a nap in the afternoon. So in our studies, we also had 2 groups of teenagers that had 5 hours to sleep per school night, so as indicated by these green lines over here. But after each short sleeping nights, these teenagers were given a 1 hour to 1.5 hour nap opportunity that started at 2 p.m. Okay, so it's after the school has ended. Okay, so you can see that these nap individuals did show fewer lapses in attention as compared to the no nap individuals as indicated by this red line up here. Okay, so napping can quite effectively attenuate performance deficits induced by recurrent short sleep on school nights in teenagers. But importantly, I want to highlight to you that these nap individuals, despite napping for an hour or an hour and a half in the afternoon, they still could not perform as well as the 9-hour group. So it seems that only sleeping the recommended duration every single day can help our adolescents to perform to their best possible level. Okay, so to conclude, the majority of teenagers in Singapore do not get sufficient sleep on school nights and try to catch up with their sleep on weekends. Now, in adolescence, deficits in a range of cognitive functions like vigilance, working memory, executive functions, etc., alertness, and mood are escalated during multiple weeks of nocturnal sleep restriction on school nights despite weekend recovery sleep. Having an afternoon nap may effectively attenuate these deficits, but when nocturnal sleep restriction is severe and recurrent, like sleeping 5 hours every single school night, even napping for a relatively long duration, an hour or an hour and a half, cannot optimize performance and well-being to a well-rested level. And delayed school start times is associated with multiple sustainable benefits, including increased sleep duration, reduced sleepiness, and better psychological well-being in teenage students in Singapore. Okay. Well, even if you cannot remember anything I've just said, this is what you need to remember. Getting the recommended sleep duration every single day seems to be the only way for optimal daytime functioning in adolescence. So when it's about sleep, there's probably nothing you can do in order to cheat your body. Okay, you really need to get the recommended sleep duration in order to function to your best level. So with this in mind, it's time for us to take a look at some tips about how your teenage students, teenage children, or actually probably yourself as well to get more and better sleep. So first of all, consider having a consistent bedtime and wake time every single day of the week, both for weekdays and weekends, okay? So you should stick to the same bedtime and wake time on both weekdays and weekends, okay? The important thing to bear in mind is that obviously you should set a bedtime and a wake time that allow you to get the recommended sleep duration. Otherwise, you will just be sleep curtailing, okay, every single night, which doesn't make sense to your health and your well-being. Now, when you do not get sufficient sleep on weekdays, just like many of us do, try to catch up with your sleep as soon as possible and do not wait until weekend, okay? Every tiny little hour of sleep actually counts. Have a relaxing bedtime routine. Okay, so before you go to bed, consider reading a book, physical one, not electronic one, listening to calming music, and taking a warm bath. Now, while we are talking about electronic book, we may also talk about general use of electronic devices. Refrain from using electronic devices at least 1 hour before your bedtime. Okay, using electronic devices before bedtime is bad for several reasons, as I've mentioned just now. Typically, during that period of time, we are having some, me time. Finally, after a long day of work, long day of studying, we can, in a way, control our own time and do something fun and relax and chill. Okay, so a lot of times we may be using our gadgets for watching videos, playing games, online games, which is very cognitively arousing. Okay, and even if we try to stick to our usual bedtime, after doing something so entertaining, cognitively arousing, our brain may be very active. It is very difficult for us to fall asleep. Okay, and then other reason for not using your electronic devices an hour before bedtime is that the blue light emitted from your devices can suppress the secretion of the sleep hormone called melatonin. And naturally, our body secretes more sleep hormone melatonin a couple of hours before our bedtime. If we are exposed to bright light and blue enriched light particularly emitted from our devices, this natural biological process is suppressed. And if we do not have enough melatonin in our body, we may not feel sleepy. And as a result, we delay our bedtime. Okay, so do not use your electronic devices 1 hour before bedtime if you want to be able to, for example, fall asleep more readily and get more sleep. Okay, talking about light, in addition to the light emitted from your devices, you also need to bear in mind or pay attention to the kind of lighting you're exposed to in the rooms that you typically spend time in during the pre-bedtime period. Okay, so some of the light we are exposed to, I know that bright light is actually very common in households in Singapore because it helps us to stay awake, stay alert, so that we can study longer, work longer, even late at night. Okay, but this kind of bright white light here on the right, okay, can have quite a bit of blue component, which, as I mentioned, can actually affect your melatonin rhythm. Okay, so if you want to get more and better sleep, consider changing your bulb to this kind of warm yellowish lighting. Okay, do avoid exposing yourself to bright light, especially bright white light, 1 to 2 hours before bedtime. Now, sleep in a quiet and dark room, this is given. Everybody knows that. So if sometimes you find yourself being woken up by noise, car noise, engine noise from a nearby highway or just by the roosters downstairs, you may want to use earplugs. And if sometimes you get woken up by lights shining through your window and your curtains, you may want to replace your curtains with blackout curtains or simply use eye shade or eye mask. And when you go to bed, leave your phone outside of your bedroom or at least switch on the silent mode because you don't want the messages incoming in the middle of the night to disrupt your sleep. Next, make sure your bedroom is cool when you go to bed. In Singapore, you can consider sleeping with a room temperature between 24 and 27 degrees Celsius. Now, sleep on a mattress and a pillow that are comfortable and supportive. You don't want to be having neck pain or back pain when you sleep. Have your last meals 2 to 3 hours before bedtime because it may be uncomfortable for you to sleep with a very full belly. Now, refrain from consuming caffeinated beverages and food from late afternoon onwards. Caffeinated beverages are very easy to get hold of these days in Singapore. There's always a Starbucks around the corner or Koi. So a lot of us drink bubble tea very often. Okay, so when we talk about caffeinated beverages, it's not only coffee or tea that we need to pay attention to. Even hot chocolate or matcha latte actually has a lot of caffeine inside. Even decaf tea, decaf coffee has a bit of caffeine. Hot chocolate also has caffeine, a little bit. And then energy drinks also have a lot of caffeine. So you need to pay attention to all of these caffeine drinks, okay? And the caffeine has a half-life of about 3 to 7 hours, okay? This range is quite big, meaning that some people can metabolize caffeine very quickly, while others take longer to metabolize caffeine. Okay, so some people may just only take 3 hours for the caffeine level to drop to 50%. Others may take 7 hours. If you are the kind that need a lot of time to metabolize caffeine, and if caffeine is very sensitive to you, okay, it makes you very aroused, alert, okay, you may need to stop taking in caffeine earlier, like maybe from noon onwards, you should not be taking caffeine, okay? And then this tip probably is only for adults, okay? Refrain from drinking alcohol and smoking before bedtime, or consider stopping them altogether. Drinking alcohol before bedtime, yes, can make you fall asleep more readily, faster, okay? But it can make your sleep in the second half of the night more shallow, lighter, okay? So you may find yourself waking up more often in the second half of the night if you drink before bedtime. Now, cigarettes have nicotine. I'm sure a lot of us actually know about this. And nicotine is a stimulant. So if you want to get a better night of sleep, get more sleep, you should not smoke before bedtime. Final tip for you today, engage in regular physical exercise. There are studies showing that doing physical exercise can help you fall asleep faster and can minimize the amount of awakenings in the middle of the night. Okay, so these are all the tips I've prepared for you today, and I'm happy to take questions.
Thank you, Dr. Jun, for sharing with us these insightful tips, very practical ones, that we can implement in our lives. I think it's also not just for adolescents, right? It's also for us, as adults. So there's one here that was submitted regarding, so this person read about chronotypes. I heard that, it's important to sleep by 10 p.m. as we get best sleep from 10 p.m. to 2 a.m. So if I have a natural pattern of sleeping from 1:30 a.m. to 9:30 a.m. as an hour, is that okay for health?
Okay, so we got this kind of question very often. What we need to bear in mind is that there are huge individual differences in terms of our preferred bedtime and wake time. As you mentioned, we have owls, we have larks, we actually also have extreme owls and extreme larks. Okay, so there's no, ideal bedtime that, you need to stick to. Okay, you need to go to bed at your preferred bedtime. If you are an owl, and I try to get you to go to bed at 10, you probably would not be able to fall asleep, okay? If you stick to 10 p.m. as your bedtime and you are an owl, you probably will take, a long time to fall asleep, and then you will find it, well, first of all, it's a waste of time lying in bed, not doing anything, and then you will hate sleeping, okay? And also what we need to know is that if you keep doing this, and if you read about diagnosis of insomnia, you probably will find yourself meeting one of the criteria, okay, not being able to fall asleep fast enough, okay? So you need to follow your biological rhythm when you pick your bedtime and wake time. And obviously, if you're the kind who needs to get up early in order to take care of your children or go to work, then you need to try to slowly shift your bedtime earlier and earlier so that you can get enough time in bed every single night. Okay. But in terms of our preferred timing, is a biological, there's a very high biological component in there. So if you can follow your biological rhythm, you should, in terms of picking your own bedtime and wake time.
Thank you. Thank you, Dr. Jun, for sharing with that. I think it's so important, right, for us to trust the body as well, to listen in as to, when does the body and mind feel sleepy, right? So
Yeah.
if we are not sleepy and we force ourselves to fall asleep by 10 p.m., that will only lead to more anxiety and struggle.
Correct, exactly. And this is part of the, a way to getting into being an insomnia, which is not good. Well, if you really, really have to try to, go to bed earlier, try shifting your bedtime, gradually. This is something that you can do. If you really cannot go to bed earlier, but you have to get up early, you can try taking a nap aside what I mentioned earlier.
All right, so maybe one more question for you. Are there any proven studies that explains the direct effects of probably effects of blue light and hormones?
Yes, there are many, 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 many studies. Okay, so this is absolutely true. For example, there is a study from Harvard, okay, that show us that this sleep hormone melatonin was actually suppressed in terms of its secretion. During the nights when the participants use a tablet to read a book, as compared to during the night when they actually read a hard copy or the physical copy of a book. So if you are into reading books, especially before you go to bed, because you find it to be, calming, you want to incorporate it into your bedtime routine, use paper book, okay, physical book, not electronic books. Don't use your tablets or your phones to read the book that you may like.
Great. Thank you. I think there's one more that I see, which is more directed to you. It actually says like, does fasting affect sleeping?
That's fasting
Yeah.
affects sleeping. So
Yeah.
like you want to keep your stomach empty before you go to bed. Well, I guess having a full stomach before you go to bed is bad. Having an empty stomach is also not advisable. At the end of the day, during the bedtime period, we need to be, relaxed and chill. Okay, if your stomach is growling and you are just thinking about, oh, I'm so hungry, I'm so hungry, I'm so hungry, then you will not find yourself being calm and relaxed before bedtime. And then as a result, you may not be able to fall asleep fast enough.
Great. Thank you, Dr. Jun, for sharing with us all these very valuable insights. Yeah, I think, we have really learned a lot, from some of these strategies that we can implement to help our adolescent children as well, and also for ourselves as adults. Yeah, so once again, yeah, thank you so much for your afternoon and sharing with us all these tips. Thank you. Dr. Foong is the co-founder and chief medical officer of Osler Health International, and her practice within the international community in Singapore over the last 7 years has seen her practice grow as she delivers a holistic style approach to family medicine, in particular, looking after children from newborns upwards, and also in the field of mental health. Passionate about providing preventive health for Osler Health patients, Dr. Foong is also a member of the British Society of Lifestyle Medicine. So I'm really excited to have Dr. Foong with us this afternoon to share with us a little bit more about women's health and sleep. And in particular, how can our lifestyle choices impact our sleep and what can we do to make positive change? Yeah, so I would like to pass the time over to Dr. Foong.
Thank you very much to you and Julian and the team at Somnus for inviting me. I know I only have 20 minutes, so please just call out and sort of get me to stop if I completely run over. I am delighted here and good to be here to share with everyone this afternoon this segment on women's health and sleep. Thank you for the kind introduction. You've done that for me already. I'm a family physician, GP, and I've been practicing for over 20 years. Just as you said, I'm also a founding member of the Singapore Lifestyle Medicine Society here. And I have that there because I'd like to talk about that, to talk around how we approach sleep as well. Equally at Osler Health, we are, as family doctors, have many areas of interest, but for us here across women's health, preventive health as well. So, just to take a step back, and we know we've already talked about that, but I just want to put up there again why we're talking about sleep and the impact, and especially when I'm going to talk about the realms around menopause and women's health as well. It's really important to look at how sleep affects us. I'm not going to go through all 6 boxes, but just to look at the top headlines, knowing that sleep actually affects our cognitive function, our hormonal balance. It actually has impact on our cardiovascular health, across the strength of our immune system as well. And sleep can also affect us at a cellular level, which is what there's a lot of interest now in the realms of precision and longevity medicine. And sleep absolutely affects our emotional health as well. So I can't talk about pregnancy and menopause without actually just sort of looking at hormones. And as much as my talk today and the brief I was given was to talk about the pregnancy and menopause, I wanted to include this slide to just show how hormones are fluctuating. And I really enjoyed June's talk earlier And that's why I wanted to incorporate this trajectory of hormones. So if we actually look at the how our hormones behave, you can see the squiggly lines across puberty and perimenopause. And actually, pregnancy and postmenopause is where the hormones are more stable. So it's important to know that we're actually, dealing with quite a lot of fluctuation of hormones as well throughout the adolescent, which what makes sort of sleep even, harder to it sometimes implement because of the fluctuation of our hormones. Okay. So we've talked about how much sleep we need as teenagers, but I just thought we'll look through the entire trajectory of how much sleep do we need, and you can see that things do shift. And let's now go into the main part of what I want to share with today is actually looking at sleep challenges throughout certain areas, certain sort of life stages. So pregnancy. During pregnancy, we divide pregnancy into 3 trimesters. And actually in the first trimester, which is up to for the first 12 weeks of pregnancy, there are a lot of hormonal shifts happening. One of the main symptoms we see at that point is actually fatigue and tiredness. For a lot of women who have been pregnant, and you hear about pregnant women talking about the first trimester, talking about morning sickness, but actually fatigue as a symptom is much more common and I guess less talked about. In the second trimester, which is from 13 weeks all the way to 28 weeks, they are in more discomfort and actually due to the increased heart rate. But I've got to say the second trimester is probably the easiest of the 3 trimesters. And in the third, it's because of the size of the pregnancy, it actually starts to press against the bladder, the heart, the stomach. So that's where a lot more of the symptoms come back. So if it's pressing on the bladder, you have to go to the toilet to pee more often. Pressing the stomach, you get more symptoms of acid reflux, and that would disrupt sleep as well. And if it's pressing up against the heart, it's also, just more uncomfortable in general. So how do we look at improving sleep during pregnancy? All that we know across 3 trimesters. Especially in the third trimester, we want to look at sleep positions, and it's recommended that you sleep more sleeping onto your left side. That goes in line with how the heart, the direction, without going into the anatomy, I'm sure some of you know, that's actually optimal function for the heart. Managing heartburn, as we talked about before. So lying flat is probably not the best idea, but lying with a slight angle would really help heartburn. Sometimes some women even end up having to use some medications like Gaviscon or acid reflux medication to help the heartburn. And restless leg syndrome, where the legs just feel like they can't settle, they just keep needing to move the legs, occurs a little bit more often during pregnancy. And insomnia, where we can't sleep based on so many different reasons we've talked about there. And throughout pregnancy, we need to want to look at the role of relaxation techniques and gentle exercise, all because that actually helps the restless leg syndrome. It actually helps, your mental state as well. Postpartum, which is after delivering and new motherhood, there are other different things we're looking at due to the new time in your life as a new mother and sort of new responsibilities. So that's a little bit more difficult in this stage because sleep is actually fragmented due to just practicalities of caring for a newborn. There is probably a little bit more mental load as well, and slight higher risk of mental health or stresses on your mental health because of the slightly higher risk of baby blues postpartum depression and probably a little bit anxious over, well, I wouldn't say little, but, what do I do for the baby? Is my baby doing well? How do I feed? Is everything going okay? And because sleep's being affected, mums feel more exhausted. Because they're more exhausted, they don't sleep so well. So it goes around in a little bit of a cycle there. And after delivering, there's also fluctuations in the hormones that are trying to settle down from pregnancy state into a post-pregnancy state. And that can also affect your sleep cycle. And that then affects the mood. So this is not exhaustive, and I will be covering a lot more of this in later on, is how do we improve sleep? It's going to be slightly tricky in the new motherhood stage because of just the practicalities of the responsibilities of being a new mom. So, naps if we can, adjusting your expectations and know you're not going to get 7 or 8 hours sleep that you wish to have, for a period of time, having extra help, and actually just really going back to looking after yourself when you can and setting some boundaries as well. What I want to go into is the next stage of menopause and how that can affect us and women at this stage. So menopause, where it's the change of hormones due to the decline in the progesterone and estrogen, can lead to a whole lot of symptoms. If you didn't know, the menopause playbook of symptoms can be up to about 30, sometimes even 50 symptoms. But the top 2 or 3 that can directly affect sleep is the complaint of hot flushes and night sweats. That doesn't just happen during the night, but during the day as well. But it does happen quite a lot at night, where if you didn't know what hot flushes were, you actually feel very hot and break out in sweat. And sometimes you're completely drenched. And women do report actually being soaked through their pajamas to the extent of that. We know that hormone fluctuations, remember that squiggly curve of perimenopause and the change in the hormones, can also affect the sleep quality and, once again, restless legs syndrome, and that is why it affects sleep. And because of so many changes in hormones and quite a lot of symptoms that can affect women at this stage, it inevitably often overall increases their stress level, and that can actually impact their sleep as well. So this is a general slide that we've had across sort of sleep deprivation, but what I wanted to put it up here was to show the impact, just some of the impact of sleep deprivation, especially for women at this stage of their lives, because it can affect their brain cognition. It does actually impact their stroke risk and future health. It can cause high levels of anxiety. It does cause high risk of diabetes. It can cause high risk of depression, weight gain, heart disease, and risk of cancers. And what we've listed on there is breast cancer as well. So how can we actually improve sleep across in menopause? One of the main symptoms is hot flushes. So it's a tricky one, because the practical side of things is if we can have more breathable and cotton sleepwear, that can help. Cooler bedding, colder air cons, that are the practical side of things. Hormone replacement therapy can work, and probably most women can have that, not all, but most women can have that, can be highly helpful, very, very helpful to impact and improve sleep. So this is one of the keys in symptom control in perimenopause and menopause that can really make a difference to sleep. And sleep hygiene, as we always talk about that across sleep tips, having a consistent bedtime, and keeping calm during the day and not just before sleep, which was covered a lot already. And I put supplements there because this is a question that we get asked a lot, whether that is going to help sleep in menopause or sleep in general. And I just wanted to briefly talk about that and what our take is regarding supplements and sleep. There could be a role for supplements in sleep, but it should not be seen as the only way to help you sleep. I think we need to understand how both of these supplements, which are commonly quoted in sleep, work. Magnesium in general helps to calm the system down. So if there are high levels of anxiety around hormonal changes during the time of perimenopause or menopause, and you are already also using techniques like having consistent bedtime, really practicing your breathing and mindfulness, then some magnesium may help to also help to keep that calm in the system. Melatonin, I tend to advise more in situations where either you have trouble regulating your sleep-wake cycle, your circadian rhythm, or mainly around jet lag, because that is where you have less control across your circadian rhythm. Earlier on, I introduced myself and said, I am an advocate for lifestyle medicine. So I actually want to wrap around what I've discussed in the earlier part of my presentation around lifestyle, using the pillars of lifestyle medicine and wrap it around everything I've been talking about sleep. I'll introduce a little bit about lifestyle medicine. So lifestyle, when we talk about lifestyle, our approach to lifestyle as doctors is actually using lifestyle medicine, which is actually an evidence-based approach to talking about lifestyle. There are actually 6 pillars to lifestyle medicine, and they're listed there. And you can see sleep is absolutely one of the key pillars out of the 6. But in addition, physical activity, nutrition, positive social connections, stress management or mental health, and then the last one, which is avoiding risky substances, which means no smoking and avoid drinking alcohol if you can. And if you do, please just drink within limits, are 6 pillars of lifestyle that will really help your health. In fact, it's the foundation to health where we know it can make up to 70 to 80% of the difference to many aspects of your health. And if I were to choose one out of the 6, I'd say that actually sleep is the primary one across the 6 that would actually have a big impact on your health. So as we look at the lifestyle factors affecting sleep, we can see how, and I'll go briefly into each one. With nutrition, we know that avoiding sugars, caffeine, and alcohol, and it's quite clear why that could affect sleep, because having sugars can give us those sugar spikes, which can actually affect which can affect our metabolism. Caffeine, as Dr. June in the last talk was talking about, it certainly will keep some of us more awake than others due to how our body metabolizes caffeine, and alcohol for obvious reasons. The role of exercise is really important in helping sleep. So earlier on, when I mentioned things like restless leg syndrome, one of the keys to that is actually keep moving, and exercise is one of them. So that is how, keeping moving actually can impact sleep. Exercise, enough exercise during the day for most people will also help sleep regulation at night. So when we look at tips around sleep, exercise is one of the key things that we can be doing to help improve our sleep. Mindfulness, I don't need to say too much about that. I mean, the team here at Somnus will, as you know them, and will tell you all about it. And obviously, we're talking about sleep here, but sleep is one of the key pillars for good health. And social connections, positive social connections actually help, across your life, and also that will also help impact your sleep. and avoiding risky substances, as we know, no smoking, keeping alcohol to limits, absolutely will also help your sleep. So sleep shouldn't, anything that will impact sleep, and this sort of 6 pillars of lifestyle medicine will hopefully help you frame an approach to your health as to what is going to help improve my sleep. I just want to sort of finish up with a quote from Roger Federer, because if you didn't know, someone like him actually needs 11 to 12 hours of sleep per day in order to not only be focused, but relaxed. And he says, you know, he doesn't think people talk enough about sleep in sports. Also, a couple of myths and misconceptions I just wanted to put out there. I think the first one, Dr. Julian Lim had already covered that. I think that not only just applies to adolescents, but I think that applies to any one of us during, you know, with sleep. I know the practicalities of life doesn't always allow us to do that, but, you know, it's true, we just can't make up for our sleep by catching up on weekends. Caffeine doesn't affect my sleep. I know we have heard that. The Italians will have their espresso 10 o'clock at night, and other people will say, I can't have a coffee beyond 2 p.m. And that's actually because people's breakdown of caffeine is different, as the last speaker, Dr. Julian, alluded to that as well. So it's important to really understand how these factors affect you on an individual basis. And as much as, you know, you may think you can function on 5-6 hours of sleep, it's probably not sufficient for most people, and chronic sleep debt tends to accumulate. We can function 5 to 6 hours because what probably ends up happening is we will keep going, and we have a lot more cortisol and adrenaline that would keep us going during those periods of having less sleep. And what happens at that point where we have more cortisol and more adrenaline is it increases our stress level overall in the background. And then that will end up impacting our sleep in the long term. So we can survive on shorter number of hours of sleep, but not in the long term. And generally probably wouldn't be sufficient. And if you think you can, it's probably because you've got other hormones kicking in to help keep you going. So my 3 top takeaways for you today to look at your sleep across this period of your life, and really and the impact of sleep on your longevity is this. Sleep is actually quite dynamic, and it changes across your life stages. There isn't one big takeaway or a magic bullet that's going to help your sleep. And my reason for putting lifestyle medicine and those 6 pillars up there is to say, in all of that, if you can pick out small, consistent habits across any of those 6 pillars and start making small little changes, which you may think it's small, they can significantly improve your sleep over time. And please do, my third one is, please do seek any medical support when you think you have a sleep issue and you think it's chronic. Otherwise, you'll be going around in a bit of a vicious cycle, and hopefully you'll see how we can support you across that is to use this lifestyle medicine approach across the 6 pillars to help you look at your sleep and give you ways you can support and improve that. So with that, I've come to the end of my segment. Hopefully I've kept to time, and I'm happy to take any questions at this point.
Thank you, Dr. Foong, for sharing with us and also walking us through, you know, like how do this like hormones fluctuation happen right throughout our lifespan as well, especially for females. One question that came to my mind, right, is I think earlier you mentioned about the hormone replacement therapy. I just wondering if you can speak a bit more about that.
Yes, I mean, as you know, Eric, we are very active in the space of supporting women through those, you know, stages of hormonal changes called perimenopause and menopause. It's such a big topic for us to cover, and it was quite difficult for me to talk about that in a segment like this. So HRT, hormone replacement therapy, is used for women in this stage to actually help symptom control. Okay, and so two arms. It will help symptom control, to help control symptoms that women experience as they go through perimenopause and menopause. And sleep disruption is one of the highly reported symptoms. It's one that when you have these fluctuating hormones, it really can disrupt your sleep. So HRT can have a big impact because what it sort of does is it helps to stabilize the hormone, if you like, across that roller coaster. Remember that graph that looks like a squiggly line? So giving regular HRT actually helps to stabilize the hormone at that point, and that is going to help improve sleep. Postmenopausally, when that line is quite straight, you'll say, so why are we using HRT? That is used more in terms of prevention of what we call future health, right? So reducing sort of the risk of future health. So HRT has got a lot of benefits. I think this is, a discussion for a different topic, but there is a lot of concerns around HRT, and I don't think that I can cover that in my time here. But HRT definitely will work for most women, and it's actually available and can be taken by most women.
Thank you. Yeah, I think yeah, that's very helpful. Yeah, because I think some people do ask about it. Yeah, and I think it's helpful to kind of like share a bit more about this area and how that helps with sleep, especially for women going through the phase. Yeah.
And actually, may I add, if we want me to expand on that time, perimenopause actually is the time before a woman goes through menopause. And maybe for just the sake of saying what perimenopause is the period where that hormone was going through that fluctuation, right? And this can occur up to from a few months to a few years before menopause. Menopause, the average age of menopause is quoted as being 50. Okay, so menopause is where your ovaries or women's ovaries stop producing progesterone and estrogen. But perimenopause, which is the time before menopause, can occur up to many, many years, sometimes up to 5 or even quoted 10 years. So HRT can be used in the perimenopausal phase. So we don't have to wait until a woman has gone through menopause or has hit menopause. So I think maybe that is the key of what I'd like to share today, to say that if you start experiencing sleep disturbance during the perimenopausal phase, then please go and see your doctor and talk about it, especially if you're in that age group. You don't have to wait for hot flushes. It's not the only symptom. Sometimes sleep disturbance is a key symptom, or is one of the symptoms. And you may say, some women may think, oh, that's because I'm quite stressed about work, so on and so forth. But it requires a doctor to go really in depth to look at your symptoms. And if appropriate, HRT can be prescribed, and that can actually make a difference and quite an impact to improve sleep.
And maybe just one more thing, which is like, how early would that be, like in terms of age-wise?
So the average age of menopause is around 50. It's different for different ethnic groups as well. And in fact, even across Malay, Chinese, and our ethnic groups here in Singapore, it's from about 46 to across to 53 to the early 50s. So if I've sort of mentioned earlier, perimenopause can be up to a few years before that age of menopause. We could be looking at a 40-year-old starting perimenopause, and we can consider giving that 42-year-old HRT if appropriate, if her symptoms warrant that. So I think the key maybe for me to get across today is, sleep disturbance may be a symptom of perimenopause, which can start for some women late 30s. Not so common, but maybe from 40, early 40s. So please don't wait until what a woman thinks is menopause, but think about the perimenopausal period that can go on for many years before actual menopause, and HRT can be used. So it's important to have a conversation with a doctor who understands this phase of a woman's health journey, to have a proper in-depth conversation to analyze the situation for you.
Great, thank you. Yeah, I think that's really useful, right? To really have more insights into this whole space itself, right? And in fact, I think many of the clients that we see as well, sometimes, from they also experience like insomnia, right? Because a lot of times they also feel very anxious, right? About that inability to fall asleep when they need to, right? And
Yes.
on top of it, when they're experiencing perimenopause, that can be an additional stressor as well.
I mean, insomnia is a symptom of also
Yeah.
perimenopause or menopause. So, as I said earlier in my presentation, there can be up to 30, 40, even 50 symptoms. So you start, and sometimes what women say to us when they come to us at this stage is, I just don't really know what's going on. Are all these symptoms, as more and more symptoms come through, they start getting, sometimes rather anxious about it, right? And the anxiety in itself then impacts their sleep. So it is a very, very big topic and a very, very big area. One that, the key is, if you think you're in that age group and it's starting to affect you and your health, see your doctor.
All right, so just one last question. I'm looking through the list from the Mentimeter. So there was one that is directed to you. It says, "Hi, Dr. Foong, how does caffeine disrupt sleep pattern if one still goes into deep sleep?"
I would say that the impact of caffeine is very, very individualized. Just as, if you didn't know, similarly, the impact of alcohol. So caffeine does, if you think you're going to deep sleep, and you have good quality sleep, the correct deep light cycling and the light REM cycling, and it doesn't affect you, and you wake up feeling rested and you don't have any symptoms, then you are probably the fortunate one who can have caffeine and still sleep well. So it's really on an individual basis. I wouldn't really say, I shouldn't have caffeine after 7 p.m. or after 2 p.m. Is really, really individualized. And that's why, medicine has moved to a point now that we have enough data. So if you have enough deep sleep, I would, if you're able to, track your sleep and see how much deep sleep you get, where your deep sleep is in your cycle at night. Because you may think you have deep sleep, but you may not really be in deep sleep. So if you are in deep sleep, great, carry on having your caffeine. But what everyone should know is the impact of caffeine, alcohol is actually very, very individualized.
Thank you. Thank you so much, Dr. Foong, for your time today. Yeah, I'm sure,
Thanks for having me.
our audience, really learned a lot from you. Yeah, so once again, appreciate your valuable afternoon to share with us many of these key insights, especially relating to women's health in particular.
Thank you.
So Dr. Han is the medical director of the ENT Voice and Snoring Clinic at Mount Elizabeth Medical Center, Orchard, and he graduated from the School of Medicine, National University of Singapore, and went on to complete his specialty training in otolaryngology, obtaining the Gold Medal Prize. And given a Singapore Health Manpower Development Plan Award, he did his subspecialty training in sleep medicine and surgery at Stanford University and at University Pittsburgh Medical Center. Dr. Han has also practiced for 20 years in the public sector and is currently a visiting consultant at the Sleep Disorders Unit, Singapore General Hospital. One thing to note is that he pioneered the use of the transoral robotic surgery in the management of sleep apnea in 2012. He's also part of the pioneer team of surgeons who performed the first hypoglossal nerve stimulator implantation in Southeast Asia in 2022. To date, they have performed more than 100 implants in Singapore. So it's my great pleasure to pass the time over to Dr. Han to share with us a little bit more about how can we distinguish what's normal snoring and when does it become a medical problem which gets in the way of our sleep. Over to you, Dr. Han.
I will share with you a little bit about what I do on a daily basis, which is basically seeing patients with snoring and sleep apnea. And I call it the not so silent killer because most people would have heard what snoring sounds like, and no one can actually really seem to enjoy that sound. So disclosures, I don't have any disclosures. I have no conflict of interest. I'm going to talk about the burden of obstructive sleep apnea, the current treatments and challenges in the treatment of patients with sleep apnea, and an overview of this new treatment paradigm option that patients can now choose to treat sleep apnea in lieu of other traditional treatment options. So what is obstructive sleep apnea or sleep apnea? The word sleep apnea just basically means that you stop breathing during sleep. And the majority of patients who do that actually have obstructive sleep apnea. That means that the air passage gets blocked during sleep and they start to snore and their breathing becomes interrupted or it stops and then the oxygen levels drop. So this is a typical picture of somebody with obstructive sleep apnea. He's middle-aged, overweight, tries to watch television but knocks out straight away. He has no problems falling asleep. He may have problems maintaining sleep, but he just generally feels tired and crummy when he wakes up. So basically, when the upper airway obstructs repeatedly, it then causes airflow limitations into the lung. And this then causes blood oxygen levels to drop, and your brain cannot rest because it is struggling with oxygen issues. So it causes frequent arousals from sleep, from deeper stages of sleep to lighter stages of sleep, even waking you up from sleep sometimes. So I'm going to show you a picture of what an upper airway looks like in a normal patient and what the upper airway looks like in a patient with airway narrowing. So a lot of sleep apnea traits are inheritable, 30 to 50% of them. And when you are, when you have inherited certain craniofacial features that make your airway narrower and your parents both snore, then sometimes it's not possible to run away from this problem. Okay, I'm going to play this video, but I'm not sure whether there's going to be any sound. This is a video of a patient sleeping, undergoing a endoscopic examination of the upper airway. So I'm not sure whether you can hear any sounds right now. But basically, I'm going through the patient's nose. We are entering the throat, the upper airway, and we are going to wait until the patient starts to snore. So I'm not sure. Eric, can you hear any snoring sound? Not really? Okay. But this really shows the upper airway closing up. And this is exactly what obstructive sleep apnea is. The entire upper airway closes up and blocks up. And you can see the vibrations and the snoring sound will be heard throughout the room. So this is basically what I see on a daily basis. Patients with airway issues during sleep. Okay, next slide. So, interesting. When you have obstructive sleep apnea, okay, yeah, somebody is drawing on my slides, which is also quite interesting. We classify you after being assessed into having mild, moderate, or severe sleep apnea. So a normal individual can have up to 5 episodes of airway obstruction per hour of sleep. So if you have more than 5 episodes of airway obstruction during sleep or breathing interruptions during sleep, you have sleep apnea. If you have between 5 to 15 breathing interruptions per hour of sleep, you have mild sleep apnea. If you have between 16 to 30 breathing interruptions of sleep, you have moderate sleep apnea. And if you have more than 30 breathing interruptions per hour of sleep, you have severe sleep apnea. So for anyone who has moderate to severe sleep apnea, we will offer treatment. Now, a lot of patients then ask me, I snore every night. Am I okay? Well, I have to tell you that there is a big overlap between people who snore and people who have sleep apnea, and it is a spectrum. So for some patients, when they start to snore, their snoring might be occasional, like for instance, when they're lying on their backs after they drink a little bit of alcohol, But as the years go by, they realize that their snoring becomes regular, no longer occasional. And as the years go by, as they get older, they find that their sleep is not as refreshing as before. And their bed partner or their family members then observe that, hey, last night when you were snoring, I thought you were choking. So it is a spectrum. You might start off with simple, regular snoring, but as time goes by, you might develop sleep apnea, and the severity of your sleep apnea might progress. Part of the reason is that one of the chief causes of actually sleep apnea is poor muscle tone during sleep. And this muscle tone that we're talking about are the upper airway muscles. As you get older and older, your muscle tone level drops. And so that's why the most common age for presentation for sleep apnea is middle age. Now, how common is this? Well, in a Singapore study that was done, about close to about 8 years ago, they actually surveyed the population and they found that actually patients with moderate to severe sleep apnea, at least in Singapore, the incidence was about 30%. And the alarming thing is that more than 90% of these patients actually didn't think that they had a problem. And this is the racial breakdown of patients with sleep apnea. So you can see that this is a very prevalent problem, and it's also alarmingly underdiagnosed. So why do we care about sleep apnea? Now, any problem that affects sleep quality will also affect health. I think you heard from our previous two speakers that sleep is one of the fundamental pillars of health. So whenever there is a problem with sleep, there will be a problem with health. Now, sleep apnea has one other dimension. It not only causes poor sleep, it causes poor oxygen levels. And when poor oxygen levels occur, not only do they cause inflammation in the body, it damages blood vessels, and all of these lead to increased risk of heart disease, strokes, heart attacks, diabetes, and the neurocognitive effects of sleep apnea also lead to increased risk of mood disorders like anxiety, depression, and sometimes, it leads to actually cognitive impairment, poor memory, and long-term wise has been linked to, as you heard, cancer and dementia. So for all of these reasons, we want to treat sleep apnea. Now, if you look at the data, if you have sleep apnea, you're more likely, 3.5 times more likely to suffer from a fatal heart attack in your lifetime. And is similar in men and women. If you have sleep apnea, you're 2 to 3 times at increased risk of developing high blood pressure. Okay? If you have untreated sleep apnea, severe sleep apnea, okay, you have a 3-fold increase in all causes of death in your lifetime. And all of these are long-term, large cohort studies that have been done many years already. And basically, for all of these reasons, we are very keen to treat sleep apnea. It's common, it causes poor sleep, tiredness, neurocognitive effects, but the long-term cardiometabolic effects and risk of mortality and morbidity are why we are very keen to treat sleep apnea. So sleep apnea is not just about a simple snoring. He snores so loudly, he must be having great sleep. The issue is if he snores badly, he's choking, he's probably not doing well during sleep. So how do we then diagnose sleep apnea? So this is just a slide of, it's just a lighthearted slide of how we do a sleep study. So what we need to do a lot of times is a sleep study. That means that we monitor your physical parameters during sleep, including your brain waves, your brain activity, heart activity, lung activity, muscle activity. And throughout the period of one night, we look at all of these parameters to determine if anything is wrong. There are many different kinds of sleep studies. There is the in-lab attended sleep study where, the equipment is placed on you, somebody is actually monitoring your sleep. This is usually done in more complicated sleep disorders, but for some patients with a lot of comorbidities, we also do this just for sleep apnea. The same study can be done at home without anyone in attendance. And nowadays, the equipment that we use is more and more portable. So you can wake up, go to the toilet, get a cup of water from the kitchen, go back to bed, and it will not disrupt the night's worth of sleep study. There is a home sleep test that we can also do, which is a modified, simplified version of a comprehensive sleep study. And this is primarily aimed at just detecting obstructive sleep apnea. But it is accurate enough for us to make a good diagnosis and offer treatment. Of course, with the advent of like the Apple Watch, your Garmin fitness trackers and all that, there are more simplified versions of tracking your sleep, but these devices need to be validated before we use it to make a diagnosis. But some of these devices are pretty good at determining your oxygen levels, your heart rate, and basically your body position or the movement that you make during sleep. Okay, so once you have your sleep study done and we are able to tell whether or not you have sleep apnea, we will then decide whether or not, based on your symptoms and your severity, whether or not treatment is needed. Now, a lot of people think that treatment is very easy, but I can tell you, like this woman has found out that sometimes treatment is not so easy. So when we talk about treatment, we talk about three broad categories of treatment. Lifestyle adjunctive treatment includes weight loss for patients who are overweight or obese. For patients who have poor sleep hygiene, they need to improve their sleep hygiene. And for some patients, they also will benefit from something called myofunctional therapy, which is basically, at the heart of it, helping the patient close their mouths and breathe through their noses. That is what we call adjunctive measures. These usually apply to patients with very mild sleep apnea or who have snoring, only snoring. Then there are devices that we use in the treatment of sleep apnea. This includes what we call continuous positive airway pressure devices or oral appliances. And then there is surgery. Surgery, there are two kinds of surgeries. One is what we call anatomical surgery, which may involve the modification of either soft tissue or skeletal tissue. And then there is what we call upper airway stimulation surgery. So broadly speaking, these are your treatment categories and your treatment options. Now, CPAP is the gold standard of treatment for sleep apnea. It is basically a machine that you wear through the use of a mask to interface with the machine, and the machine blows air. So instead of trying to pull the air into your lungs to breathe, this device actually will do that work for you. Unfortunately, while it is very, very effective, there are many, many patients who are unable to sleep with it properly. So even though it is considered the gold standard of treatment, if you look at all the studies through the literature through the years, there is a large percentage of patients who are unable to use it for more than 4 hours a night. And 4 hours a night is what we consider the minimum pass rate for a successful night of usage. So if you kind of look at all the data, what it means is that only 50% of patients will be able to tolerate this on a long-term basis. So when you look at all the studies, including big, large-scale studies, you will notice that compliance is the main issue for basically CPAP. It is not the efficacy. It is very effective, but it is not effective if you don't use it. It is a long-term treatment. You cannot stop using it. The moment you stop using it, your sleep apnea returns to its original state. So this mode of treatment was actually first described in 1981 by a man called Colin Sullivan. He's an Australian respiratory physician. And he himself admitted, years later, that the main problem with CPAP use is compliance. So what are the other options then? There is another option of something called an oral appliance device. Basically, it is a dental device that you put onto your upper and lower teeth, and basically it pulls your lower jaw forward, pulls your tongue forward and clears the airway at the back of your tongue. It is also quite useful, but it is mainly reserved for patients with mild to moderate sleep apnea. It is not very efficacious in patients who are overweight or obese, who have poor dentition, or they are unable to have good jaw protrusion. And there are some patients that when they wear it, it causes excessive salivation, muscular discomfort, sometimes dental changes as well, including bite disturbances. Now, in my practice, I offer all of these options to patients because although it is not something that is 100% going to help everybody, when we put patients on these devices on a trial basis, some of them will be happy, some will not be happy. So what then do we do for patients who have tried the devices, tried all these options, and are unable to get any benefit from it? Then we actually look at the possibility of surgery. Now, these are all the surgical options that have been developed over the years for the treatment of sleep apnea. And the truth about it is that surgery for sleep apnea has gotten a bad reputation over the years, simply because there are a lot of patients who have had surgery done and did not benefit from it. So the current thinking now is that if there is something that's obviously narrowing the upper airway, we deal with it. Like for instance, if you have a very crooked nasal septum, very blocked up nose, then surgically clearing the passage of the nose will definitely benefit you. If you have huge tonsils like this that are blocking the airway, then removing the tonsils will definitely make a difference for you. But if you do not have anything that's obviously narrowing your upper airway passage, then just doing surgery alone may not help you enough or at all. So this is really a new way of understanding sleep apnea, because in the past, no matter who came into the ENT practice, surgeons will be offering surgery. We now know that we should be offering surgery to patients who will benefit from surgery and not the other way around. So because of this, all of the data that has come out, there is a procedure called a uvular palatopharyngoplasty, which was described in the 1980s as well. Now, through our understanding over the years, we now know, and the American Academy of Sleep Medicine now says that we should not be offering this surgery for patients indiscriminately. We only offer surgery if it will help the patient and if the patient has already tried other options of treatment that didn't work. And why is it that soft tissue surgery doesn't work? As I alluded to earlier, one of the main reasons for actually sleep apnea is this insufficient upper airway muscle tone during sleep. Now, nobody, when you are awake, nobody really snores. When you are asleep, you start to snore. Why? When you are awake, the brain sends signals to the upper airway muscles to keep the airway open. When you are asleep, those signals get shut down because the brain wants to rest. So a lot of times, these things are not apparent when you are awake. It is only apparent when you are asleep. Hence that video of me doing a sleep endoscopy, assessment of the upper airway during sleep, because I need to know exactly where the obstruction is, and it only occurs during sleep. So, is there then no hope for sleep apnea or sleep apnea surgery? Well, recently we've been able to offer a new form of treatment, and this is basically a new way of treating sleep apnea. So what it is basically a device, a pacemaker device that is implanted in the body that stimulates the upper airway muscles during sleep. When you are sleeping, instead of the brain sending signals to the upper airway muscles, this pacemaker is actually inserted and actually sends a gentle pulse to your upper airway muscles to keep your airway open during sleep. So you just sleep, switch on your device. Whenever you sleep, it is active. And every time you breathe in, it basically sends a pulse to the upper airway muscles to keep your airway open. So this is a new way of treating sleep apnea, and we basically now are able to offer it to patients. So what it is an implantable device. It's a pacemaker to the upper airway muscles. I will skip this video. It was invented in the 1990s. When I was in Pittsburgh in 2014, they did the first in-human trials, and I was there to watch the implantation. And over the years now, actually, this is an old slide, but more than 80,000 patients have been implanted worldwide. In 2022, we've managed to actually bring the device into Singapore, and we basically now offer this to patients. So this is a slide of the airway actually closing up whenever, when the patient is asleep. And this is actually a slide of the airway getting stimulated and keeping open during sleep. So you can see whenever you breathe in, the device actually opens up the airway during sleep. I will skip this. So this is one patient that we did in the clinic. When the device is active, you can see actually the tongue actually getting stimulated and coming forward. And this will happen during sleep and unblock the airways as well. So, I mean, a lot of patients that we would not have been able to help in the past, now we are able to offer this. This patient, one of our first few patients, had tried soft tissue surgery, CPAP, oral appliance, and couldn't tolerate any of it, didn't gain any benefit from surgery. We put in the hypoglossal nerve stimulator implant, and now he's very, very happy sleeping, and his snoring is almost gone. And of course, because the surgery itself is day surgery, so he was very happy that he had minimum downtime. So this is the first New England Journal of Medicine article from the STAR trial that was done in 2014 when I was in Pittsburgh. And we have 3-year data, 5-year data, and it all shows reduction of the breathing interruption rates to near normal levels. And this, is sustained results over 5 years. We have real-world data from multiple centers in Europe and North America and even in Singapore, and it shows consistent efficacy as well. The adverse event rate, the complication rate is less than 0.1%. And of course, there's eligibility criteria as well as contraindications to the surgery. This is the first Inspire or hypoglossal nerve implantation team doing our first implant in May 2022, and we are happy to report that we've done more than 100 since then. And this is our biggest large-scale data, but it shows consistent benefit to most patients. Okay, this is just some patient experience videos. I think we will skip that because I think we probably have some questions that the audience would like to ask, and I'll be very happy to answer them. So thank you very much for listening in and sharing this afternoon with us.
If you regularly snore, but your Apple Watch or Aura Ring shows you that you have 98 or 100% oxygen saturation, does that mean that you don't have sleep apnea?
Okay, so sleep apnea is not just diagnosed by oxygen level desaturations, it's also diagnosed based on whether or not your snoring or your flow limitation during breathing or your interrupted breathing actually causes brain arousals. So you might actually not have oxygen levels drops, but your brain might actually be keeping you in a lighter stage of sleep so that you can breathe better and maintain your oxygen. So I would say that if you're symptomatic of sleep apnea, the best thing to do is get a sleep study to make sure that you don't have all these what we call arousals during sleep. Yeah.
Thank you. The next one is mouth tapes are wildly popular right now. Would this be an option against snoring?
I would say that if your nose is blocked and that has caused you to mouth breathe, then taping your mouth with a blocked nose is just going to make you suffocate during sleep. So I would highly advise you to just make sure that your nose is really very clear before you embark on mouth taping. I know this has gone on in a large scale media with professional athletes talking about mouth taping and all that, but please don't tape your mouth if your nose is blocked. Yeah.
Great. And the last question is, why is it that we are more likely to snore when we are exhausted or perhaps when we had alcohol?
Okay, so the same reasons. When you're exhausted, what happens is that, okay, so sleep is an interesting thing. Sleep is when the body restores and basically repairs itself. And there's a process that is being driven. It's called process S. So the longer that you've been awake or the more you exert yourself, the higher your sleep inertia. And so basically what a lot of patients tell me is they crash when they've been too busy or too many things to deal with. Similarly, when you take alcohol, alcohol actually relaxes your muscles. So when you are in a very, very, very tired state, your muscle tone actually drops a lot. When you have imbibed alcohol to a certain level, your muscle tone also starts to drop. And basically, you're in a very deep state of sleep, and your body would rather trade oxygen for sleep. And so, your breathing, your snoring gets worse because your body says, look, we need our sleep. Never mind if the oxygen level goes down a little bit more, we'll just maintain sleep. So that's the reason why these circumstances lead to worsening of sleep and sleep apnea and snoring. Yeah.
Okay, great. Thank you. And yeah, just one more that came in. Does sleep apnea lead to heart palpitations?
Yes, it does. So if sleep apnea causes your oxygen levels to drop, your heart has to work harder to actually pump oxygen, reduce oxygen in the blood anyway, to your organs. So it only does that by increasing the heart rate. Yeah. And of course, the stroke volume, which is how hard your heart actually pumps. Yeah.
Great. Yeah, I think that's probably all the questions.
Great.
Yeah,
Yeah. Thank you
thank
very
you.
much, Eric. Yeah. Thank you for having me.
Thank
Yeah.
you for sharing your insights and also your expertise in this area.
Yeah, no
Appreciate
problems.
it.
Happy to do that. Thank you.
Thank you. And now it's my great pleasure to introduce our final speaker for today, and it is no other than my co-founder, Dr. Julian Lim. Yeah, so I'm really excited to have him share with us, more in the area of our brain health, right? So he's going to be sharing, how sleep affects our brain health. He has graduated from an Ivy League PhD in psychology with clinical training from the University of Pennsylvania in 2010 and has conducted psychological research for more than 20 years. So from 2015 to 2022, he was the assistant professor at Duke NUS Medical School and subsequently at the Yong Yung Lin School of Medicine at NUS as well. During this time, he pioneered mindfulness-based treatments to improve sleep health in Singapore and led an initiative to increase public awareness of these treatment options. Julian is also regarded internationally as an expert in mindfulness and sleep with more than 40 peer-reviewed publications and a position on the editorial board of the scientific journal Mindfulness. He is currently an adjunct professor at the Center for Sleep and Connection at the University of Singapore. So it's my great pleasure right now to pass the time over to Julian. Over to you.
Thanks a lot, Eric, and thanks everyone for staying right till the end. Yeah, thanks again. So in my past life as a university professor, I studied sleep and the brain a lot. In fact, that was how I spent probably the first 5 to 8 years of my research career. And so we're kind of going to do a throwback to that. And I would like to spend my time today sharing with you about how sleep affects your brain health. And this is both in the short term, so day to day, how poor sleep can affect our functioning and our cognition, but also some of the longer term consequences of not getting sufficient or good quality sleep on a regular basis. So let's dive right in. So first and foremost, I think anybody here who's had a bad night of sleep or a bad period of sleep already kind of has a sense of what I'm going to talk about. So in a certain kind of a way, I don't need to give this talk at all. We all know that when we don't sleep well at night, we are not at our best during the day. And there are many, many surveys that show that among people who have unsatisfying sleep on a regular basis or who have insomnia, some of the top things that are hit during the day are their productivity, their ability to pay attention, their memory, and so on. So we all have a very good sense that not sleeping well affects the way that our brain works and affects our brain functioning. But what I want to do is take a little bit of a deeper dive into that and explore exactly the components of cognition that are most affected and the reasons, the biological reasons why that is happening. So first of all, let's start with a very basic question, which is, how much sleep do we need to have optimal cognitive functioning? And I think you've all heard that we all need about 7 to 9 hours of sleep a night for adults. But there's also been a very, very large body of research dating back, in fact, to World War II, exploring the effects of the amount of sleep on how our brain functions during the day. And by compiling all of those hundreds and hundreds of studies, scientists have come to the conclusion that the optimum amount of sleep, at least for our cognition, appears to be about 7 hours a night. And if you go about an hour in either direction between 6 and 8, you don't see much of a drop off. But if you look at these graphs here on the right, what you see is an inverted U shape. So by the time you go out to having 4 to 5 hours of sleep, or on the other side of the graph, having too much sleep, about 9 to 10 hours, we find that there's actually a significant drop in our cognitive functioning. And that can be for different kinds of domains, for processing speed, for our attention, and so forth. So at least in terms of cognition, there seems to be a sweet spot in the middle where we want to get that 7 hours and not too much or too little. As I said, because we have this really large body of research, we've also been able to get a very good understanding of how the different domains of cognition are affected by sleep loss. And when I say domains, what I mean is that our brain has many, many different kinds of mental operations that it can perform. So from very complex tasks, things like problem solving, decision making, and reasoning, all the way down to really, really simple tasks. So just paying attention to monitor for things that are happening. And what we know now, and this is actually a study that I did back when I was in graduate school, is that the effect of sleep loss on those different domains differs a lot. So this is just compiling the results of people who have gone for one night without sleep. And what we can see is that very complex tasks, so tasks to do with reasoning, to do with decision making, short-term memory, and so on, are relatively less affected, whereas the tasks that are much more affected are those which are very simple. And I've called these simple attention tasks here. These are really actually really dead stupid simple tasks. So many of these involve people just sitting watching a screen for about 10 or 20 minutes and just hitting one button whenever they see something appear. So really, really simple kinds of tasks, but yet those are the tasks that are the most affected by being short of sleep. So sleep affects basic attention, and why would we care about that? Well, it's because basic attention is so foundational and so fundamental to everything else that we do. If we aren't able to pay attention to what's going on in our environment, then it's very difficult for us to kind of go on and use that information in meaningful and more complex ways. So sustained attention essentially is the ability for us to stay on task for extended periods of time. And if you had to come up with one example of a job that required that, well, I think an important one would be air traffic controllers, for example. So people who need to kind of stay and monitor signals on a screen for a long time, and where the consequences of making a mistake in that kind of a job could be really, really quite catastrophic. But we don't need to be an air traffic controller in order to have sustained attention be important to us. So, many of us drive, for example, and driving is a task that can be quite affected by sleep loss. In fact, going for one night without sleep is the equivalent of being over the blood alcohol concentration level for drunk driving. So that's not something you want to do. We just talked about surgery. Obviously, surgeons need high levels of sustained attention. But, even studying or working, like having to pay attention to a lecture or having to pay attention in a meeting, for example, does require our sustained attention. And when we're nodding off in the day, during these long and boring tasks, that often can be a function of not having enough sleep at night as well. So what are some signs that you might be having difficulties with sustained attention because you're not having enough sleep? you can ask yourself some simple questions like this about daily tasks that you might have to do. So do you find that you often forget where you've left your keys in the home, or forget where you've left your wallet, for example, in the house? Or when you should be listening to something, for example, listening to me give a talk now, do you find that your mind is daydreaming and wandering off and you suddenly lost the thread of what's going on? Do you find that you forget why you went from one part of the house to another? So you find yourself in the kitchen and you have no idea why you went there. Or if you're reading a book or the newspaper, having to read the same line several times because you find that your mind is somewhere else. And all of these things that can happen to us from time to time, and they don't necessarily mean anything terribly bad. But if you find that these lapses happen to you a lot and very often and on a day-to-day basis, one of the key underlying reasons for that could be that you're not having enough sleep at night, and that is affecting your ability to pay attention. So I just want to talk a little bit about what's going on in the brain that affects our attention. And one way to think about this is to think of the brain as kind of a traffic control center, right? So all of the information that enters our brain are like cars that need to be monitored. And what we want to do is, for example, let in the red car and make sure that all of the black cars don't get in because maybe they're not relevant. And so when the well-rested brain, in the first place, there aren't so many cars going in. Like our brain is better able to filter information in the first place so that there's not so much distracting and irrelevant information that's competing for our attention. But also our brain has conceptually what we can think of as different kinds of traffic lights. So when our brains are well rested, we have more of those traffic lights, more of those stop points in place so that we can only allow the relevant red cars in and keep the black cars out. When we're sleep deprived, when we don't have enough sleep at night, that system gets compromised. So for a start, there's much more information that starts coming in. Our brains are not able to filter out distractions. We may be more distracted by thoughts, by things that are going on in the environment. And so there's just more black cars that we need to keep out in the first place. But unfortunately, when we're sleep deprived, what also happens is that the number of traffic lights, the number of stops that we have in our brain also decrease. So now we have a lot of information to filter and relatively less resources to filter those irrelevant black cars out. And that's the reason why we find ourselves distracted more, why we make more mistakes, more lapses, and perhaps even sometimes respond to information that we shouldn't be responding to. So that's how sleep affects attention. The next thing I want to talk about in terms of our cognition is that sleep also affects our memories. Now, we may think of sleep as a time where not very much is happening in the brain, but actually completely the reverse is true. Even though we are unconscious at night, it still is a time when the brain is really quite active, making sense of the information that we've acquired during the day. So when we go through an average day, we are constantly acquiring new information and sometimes new skills. So we go to work, we learn new things about projects that we are engaged in, or if we're a student, we study new information. And the brain takes that information and it puts it into short-term storage for the time being. Now, interestingly, when it comes to the night, this is actually the time when the brain takes all of that information and starts to put it together in a much more long-term consolidated way and starts to form these new connections between cells that are called synapses. And it's these connections between different neurons that kind of sustain our ability to form longer-term memories, to be able to encode and retain information and skills in the longer term. And so we can kind of think of this as like a tree growing, a little bonsai tree growing in our brain. So as we gain information during the day, more and more of those roots and branches start to grow, and the tree of our information and knowledge grows as well. But the thing is, we don't want to remember and retain all of the things that we learn during the day, right? So it's not very useful for me, for example, to remember what I had for breakfast 2 months ago. I don't necessarily want to remember that, but I do want to remember important facts, key pieces of information, new people that I've met, and so on. So the fascinating thing about sleep is that it's during this time that important memories that are formed during the day are consolidated, and just like trimming a bonsai tree, the unimportant information that we learned is actually discarded. And again, there have been many, many studies showing that sleep is a very important time for memory consolidation. And one of those, for example, is where was actually done by our own lab back when I was in NUS. And in this study, we brought two groups of students into the lab to learn information for an imaginary, for a test they were going to have at the end of the day. And this information was just Wikipedia facts about certain kinds of animals, crabs and frogs. And we divided these students into two groups. So there was one group that actually got to study for the entire day from the morning into the afternoon and then take the test. And the second group of students got to study in the morning, and then they actually got the chance to take a nap in the afternoon before taking the test. So they had less time to study than the first group who got to study the whole day. But when it came to taking the test, interestingly, what we found was that the group who had studied less but had the time to sleep and consolidate that information before they were quizzed actually did better than the group that got to study the whole day. And this is a finding that's been shown many, many times, that sleep actually is not a time when we are just unconscious and our brains aren't doing anything, but that they're actively making sense of the information we have so that we can retain it better and use it more effectively when it comes time to recalling it. The third way in which I want to explain how sleep affects our brain and our brain health is that sleep is very important in affecting our emotions. So I want to introduce you to this part of the brain, which is very important. It's a really small part here that is tucked into the inside of the older part of our brain called the amygdala. And the amygdala is an area of the brain that signals emotions. And it's very important for signaling when there are threats as well that we have to deal with. So if I'm if I'm going for a hike, maybe in another country, and during my walk, I come across this big bear in my path, my amygdala is going to sound the alarm, say, danger, unsafe, you need to get out of here. And it's going to send a signal over to another part of the brain called the hypothalamus. And the hypothalamus is responsible for a response to that threat. So it tells me it's time to be afraid, it's time to be stressed, it's time to mobilize the resources in my body so that I can either fight off the threat or run away and get to safety. And this is a very important system in our brains, obviously, because if we didn't have this, then when a physical threat came along, we wouldn't feel anything and we would probably get eaten by the bear. So there's a very good reason for this system to exist. But unfortunately, what happens in modern society is that we don't have to deal with many physical threats. At least I hope none of you come across bears on a regular basis. But we do end up using this system a lot for imagined threats or other kinds of threats that we perceive coming up during the day. So maybe our boss telling us that we have this whole pile of work that we need to do by tomorrow, or there's this colleague that we don't like and we are assigned to work with them on a project. And all of these little things during the day can also take over the system and cause us to activate the stress response. Now, one important function of sleep is that it regulates that response so that the system is not so active. And when we don't get enough sleep, when we're sleep deprived, it actually increases activity in the amygdala, so that signal goes up. It makes it harder to turn off this danger signal, and this leads to us having much more difficulty controlling our emotions and our stress. And over time, if this happens once in a while, it's not too much of a big deal. But if we don't get enough sleep on a regular basis, chronic sleep loss can cause the system to be constantly on. And that can lead to many, many problems, including increased inflammation in our bodies, having a compromised immune function, and if those chronic problems go on for long enough, eventually turning into more serious issues, like, for example, cardiovascular or psychological disorders. And that leads me into my last segment, which is talking about the longer term consequences, again, of having insufficient or poor quality sleep. And that lies on the fact that sleep is a time when we get actually a nightly detox for our brain. So when we use our brain during the day, just as part of normal usage, the brain accumulates all of these waste products. And the night and sleep is a time when one of our systems, is called the glymphatic system, actually is able to operate and clear those waste products from the brain. And we need that nightly detox in order to kind of reset the brain and make sure that certain harmful substances are not accumulating over time. One of those harmful substances is something you may have heard of called beta amyloid. This is a peptide that is responsible for dementia and Alzheimer's disease if it accumulates too much in the brain. And there are studies now showing that even one night of sleep deprivation can lead to measurable changes in the amount of beta amyloid that accumulates in the brain, and particularly around this area called the hippocampus, which is a very important area for forming and retaining new memories. And again, this is not something that we need to worry about if you have poor sleep on a one-off basis or once in a while. The brain is very resilient and good at clearing amyloid over time. But when we have short sleep in the long run, when we regularly ignore and deprioritize our sleep health, that can indeed lead to problems. And this is one of the very good studies that have come out recently showing that. This is the Whitehall study in the UK, where they studied about 8,000 civil servants over the course of 20 years to look at different risk factors for developing disorders in middle age and older age. And what this study found was that sleeping less than 6 hours a night at the ages of 50 and 60 on average increased the risk of developing dementia further down the line. And this was up to a 37% increase in that risk. And this was independent of other socio-demographic as well as health factors that they studied. So just to summarize what I've said today, having insufficient or poor quality sleep is not good for your brain and it's not good for your brain health. In the short term, it can have effects on attention, which may lead to lapses that can affect you during the day, as well as memory consolidation and retention. It can affect your ability to regulate your emotions and to regulate stress. And if that goes unchecked for a long period of time, that increases the risk of chronic diseases. And finally, having insufficient sleep can affect our brain health in aging, increasing the risk of dementia and Alzheimer's disease. So I think all of the other speakers have given you really, really good tips already. I just want to close off with 3 steps that you can take if you want to improve your sleep health. And I think the first of these is just to merely make sleep a priority by internalizing its value. I think all of the speakers today have done a wonderful job of showing the effects of sleep on health, but also helping us think about how much better our lives could be if we have good sleep. And by recognizing the value of sleep in the first place and how important it is as a pillar of health, that already is a really good step to motivating us to make sleep a priority in our lives. Apart from all of the practical sleep hygiene tips that we've heard, I think that one really, really important step is for us to learn how to actively practice stress management skills. And these are things like exercise, meditation, mindfulness, relaxation techniques, and so on. These are things that we do during the day. Sleep is not something that we should only worry about at night. It's a 24-hour process of making sure that our bodies are in a state of good mental health, of good mental relaxation, so that when it comes to the night, we are already ready for biology to do its work. And the final point I want to make is that I think it's important to aim for good sleep, not perfect sleep. If you're not a very good sleeper right now, if you're only sleeping 5, 6 hours a night, it can be a very daunting task to suddenly say, okay, I'm going to find 2 extra hours to sleep during the night. And that can prevent you from taking any steps in the first place. So rather than kind of go for that gold standard target to begin with, maybe take small incremental steps. So perhaps just say I'm going to put aside 15 minutes extra for the next few weeks to go to sleep. Or I'm going to cut down, by 15 minutes of screen use at night so that I can put that time towards relaxation or towards stress management. And little steps can go a long way. By aiming for good sleep rather than perfect sleep, we're heading in the right direction rather than making this ideal sleep kind of the target and the holy grail. And with that, I think that's all I want to say. So if there are any questions, I'm very happy to answer them.
Thank you, Julian. I'm so glad you left us with so many of these practical steps as well, right, to kind of round up whatever that we have learned from the various speakers from this afternoon. So actually, there's one question that one of the audience have asked, which is how effective is therapy exercises? When does it help? So I think it's referring perhaps to some of this behavioral therapy that can help with sleep.
Behavioral therapy can be quite important for improving sleep quality. As I said, having poor sleep often is a matter of anxiety and of not looking after your stress during the day. And if that goes unchecked for a long time, it can lead to the problem of insomnia, which is basically taking a long time to fall asleep or waking up in the night, finding it hard to get back to sleep, and being bothered by that sleep quality on a daily basis where it really interferes with your ability to function during the day. And if that is an issue for you, then the top recommended treatment actually is cognitive behavioral therapy. And this is a treatment where a therapist will help you to understand the root causes for your insomnia and teach you how to change your behavior and change also the way you think and change some of the thoughts and beliefs you have about sleep so that those don't interrupt you and disturb your sleep during the night. That's a therapy that we specialize in very deeply at Somnus, and if it's an issue for you, we are very happy to offer our help and support.
Great. And I think another question is, can you explain what deep sleep versus REM sleep does for one's restoration and rejuvenation?
Yeah, good question. So deep sleep is one of the stages of sleep that the body will prioritize. We usually get it towards the beginning of the night, and it's a time that's really important for physical repair. So physical repair of tissues, as well as maintenance of our immune system, regulation of inflammation, and so on. REM sleep is something that usually happens towards the morning, the second half of the night. This is a time when we have our most vivid dreams, and it has its own separate functions to do with memory consolidation, with emotional regulation, and so on. So the brain is doing different things at those different stages of sleep, but they're all kind of important. So the brain knows how to get enough of each stage of sleep at night as long as we go to sleep under the right conditions, we are relaxed, we have enough time in bed.
Good. And there's one other question that just came in, I think I saw, which is how is mindfulness different from other meditations to help with sleep?
That's a question you should be answering, actually.
Yeah, maybe it was directed to me. I'm not sure.
Mindfulness is, I wouldn't say mindfulness is meditation per se. Mindfulness is a skill. So mindfulness essentially is the skill of awareness. And it's a particular kind of awareness in the present moment and with accepting the experiences that we're having without wanting to label them or judge them in any way. Its effect on sleep is, well, I would say that we know a lot more about its effect on sleep because of research. It's one of the fields, it's one of the kinds of meditation that's been studied a lot now by modern science. And there's a lot of studies showing that mindfulness particularly has benefits for sleep quality. So helping people to fall asleep faster, to feel more satisfied with their sleep.
I think one thing I'll add to that is that, many a times people turn towards meditation to get themselves to sleep faster, right? And one thing I like to mention about that is, don't use meditation or mindfulness practices as a way to kind of force yourself to sleep. Right. So a lot of times people approach it, with the outcome in mind that, okay, if I do this practice, maybe after the 20 minutes boy scan, I should be able to fall asleep very easily. Right. And I think that's actually what's, going to get in the way, right? When we hold very tightly to such outcomes. So I think what's more important is like what Julian just mentioned, right? Which is really to adopt this attitude of non-judging, right? And to adopt this attitude of curiosity. So as I'm going through the boy scan practice, I'm going through maybe a breath practice in itself. Why am I noticing changing moment to moment, right? And just being very open to the outcomes. And that will oftentimes create a more conducive internal environment that helps sleep to arise naturally. With this year's theme of World Sleep Day to be make sleep your priority, I think it's especially important as any, right, for us to recognize, after hearing so much about, what sleep deprivation can do for our body and mind, but also to realize that, if you're experiencing poor sleep, you're not alone. I think that's a very important message now put across that, there is a possibility, right? There is hope, right? That, this can be resolved, right? And over here at Somnus Sleep Wellness, both myself and Dr. Julian, we are really very passionate in the work that we do. We really hope to help people to get better satisfying sleep, right? So that, we not just survive, right? From day to day, but we begin to flourish and thrive in our lives to have meaningful relationships, right? So that we increase this sense of health span that we have.
I think it's very important not to take sleep for granted and not to kind of suffer in silence and wait for too long. So I think, many people are already very aware of the importance of having healthy lifestyle habits that will last you for a life. And people are aware of the importance of diet and exercise and make efforts for that. And I think one of the things we're really trying to push for is to have people realize that there are proactive things you can do to help your sleep as well, and not kind of take this wait and see attitude. So if you feel that you're not happy with your sleep, if any of your relatives or your loved ones also are having problems with their sleep satisfaction, do encourage them to reach out and seek help. It can really improve the quality of your life in such dramatic ways. And yeah.
Yeah, so I think with that, I, have a great offer for everyone, right? So now they have learned so much about sleep. I think it's also helpful, right? If we can take this opportunity for ourselves, right, to invest in knowing a bit more in assessing our current state of sleep health. So this is our Somnus Sleep Health screening that we do like to offer to everyone who has tuned in for this afternoon of our sleep webinar. So it's a 20-minute self-administered session where you can do it in the comfort of your own home, and you get to understand different aspects of your sleep health, ranging from whether are you at risk from insomnia, in terms of, what are some of these common sleep disorders, including your risk for obstructive sleep apnea, like what Dr. Han mentioned earlier. Give this a go, and also to share this with your loved ones, your family members, your friends, your colleagues, right? And for today, you can put in this promo code WSD25. So you can scan the QR code that you see on the screen right now, and that will give you $10 off from the usual rate of $17.50. Okay. Dr. Foong also mentioned the importance of, taking care of our stress, right? So stress management is a key component and also a key pillar of lifestyle medicine. And I think, what's also very important is for us to kind of train our mind as well. So we do have this mental fitness club that I'd like to invite everyone to give it a go, where we meet regularly on a weekly basis, virtually as well, where you can engage in evidence-based scientific practices, right, to strengthen your mind. And this can really help us in the long run, not just with our sleep, right, but for our health and our mental well-being. We have recently partnered with a luxury hotel here in Singapore, Como Metropolitan Singapore, and they have launched this Sleep Dreams, which is a 4-day, 3-night program. And we're really excited to offer our sleep screening to all their hotel guests who have opted for this Sleep Dreams package. Yeah, so apart from that, we do also offer sleep coaching services for you to enhance your sleep quality. So with that, once again, thank you everyone to our partners, to Osler Health International, the ENT Voice and Snoring Clinic, Vibe Studios, and really today's webinar is really in support of World Sleep Day, which is yesterday on 14 March 2025. So we are really glad to bring back our flagship webinar to all of you so that you can learn the art and science of sleep. We are also really excited that we have been featured in the local media and also international media, including Money FM 89.3, New York Times, and CNA. Follow us on our various social media channels, be it on Facebook, Instagram, LinkedIn, and also to follow us on Eventbrite. And you have not already signed up for our mailing list, please do so that you can be kept updated of our latest offering. So once again, thank you everyone. Appreciate everyone's presence. So take care and we hope to see you all soon. Thank you everyone. Bye.